We now go to our reporter Laura Windsor, who looks into whether or not diet or herbs can help fight cancer.
Herbal supplements are considered by the FDA to be foods, not drugs, and therefore are not subject to the same testing, manufacturing, and labeling standards. We went to Valley Presbyterian Hospital in the San Fernando Valley and spoke to Dr. Sheila Vasan. We asked her if diet and herbs help in cancer care.
There's a question that keeps coming up in my office almost every day, and that is after we talk about the treatment, somebody's come to me, they've been diagnosed with cancer. The first thing that they ask me, is there anything I can take herbally? Are there any exercises I can do? Is there anything I can eat that will help me fight this cancer? And I do believe that feeling well and having a good mental state of health will help somebody deal with cancer therapy. When somebody is actively getting chemotherapy, I feel strongly about not taking herbal therapies. And the reason is many herbal therapies, such as ginkgo biloba, St. John's wort, which actually is used very much for depression and to feel better emotionally, most of these herbal medications, especially ones that maybe come from East Asia or from India, many of them are cleared or metabolized by the liver, which is the exact same way chemotherapy is cleared and metabolized. So you can only imagine that if somebody's getting chemotherapy and their liver is working so hard to metabolize and to use a chemotherapy to fight the cancer, if there's something else that the patient is taking, another herb or a vitamin or whatever it is, and that's also requiring the liver to metabolize or to make it work, the liver can only do so much. So a lot of times these herbs can, number one, either cause major toxicities to the patient, or number two, they may not allow the chemotherapy to work to the fullest extent that it should. I have seen liver toxicities from herbs in my training, in my practice, and all I can say is if you are actively getting chemotherapy, number one, if you insist on taking something, tell your doctor what it is. Be upfront with your doctor so they can at least research it and give you the proper guidance as to whether you should take it or not. But in my opinion, I think all of those should be held during active chemo. The other question that I get all the time is there anything I can eat? Is there any special diet that I can follow that would help me fight my cancer? Keeping on the weight during chemotherapy is very, very important. Chemotherapy, as we all know, just from the stereotype, and it's definitely true, causes nausea, causes vomiting, and can cause tremendous weight loss for a patient. So if a patient is to subscribe to a very, very strict diet, that strict diet may not give them the caloric intake to keep on the weight that would be required or would be beneficial during cancer treatment. What I always tell my patients is you eat what you feel comfortable with. You eat what agrees with you. Eat cooked food at home. Eat food that you know you've grown up with and works well. Don't change your diet. I would say don't eat foods that make you constipated. Don't eat foods that you know are going to give you diarrhea, but eat foods that make you feel well, that taste good to you and make you feel well so you can keep the weight on during your treatments.
Because herbal products are not subject to close scrutiny by the FDA, the use of herbal supplements is controversial. So remember not to take any herbal supplements without first consulting with your physician, especially when on any cancer treatments. For the American Health Journal, I'm Laura Windsor.